Welcome friends, this is Dr. Jaitly, your cardiologist on your favorite video channel, MuniMeterHealth, which is currently being shown on several social platforms, mainly to enhance medical education and patient education in order to combine together to have a better clinical outcome. And that's been our goal here. In fact, that's been my deepest belief, that if you combine the patient's knowledge with the medical knowledge that the doctors have, you have better clinical outcomes, both in terms of follow-ups and understanding the illnesses, taking their prescriptions well, and of course sticking with their appointments for tests as well as for follow-ups at the clinics. So without any further ado, I want to thank you for being associated with MuniMeterHealth, and let's delve into the subject matter right away. What is cardiac catheterization? Now, we do short videos, as you know, mainly to sort of improve your quick knowledge. Again, it's not a syllabus. This is a supplement to your syllabus for the sake of the medical students. So before you go take an exam, you can certainly brush up your skills a little bit. And of course, for general know-how for the patients also to understand what cardiac catheterization is, we're going to be discussing that in this short video here. So we know cardiac catheterization is a way where you can visualize the coronaries. Now let's draw the coronaries here. What are coronaries? Coronaries are the blood supply to the heart. Let's draw it here. We have a little space here. Here is the heart. And that's my favorite diagram. Obviously, it's been shown on several of my videos. This is your aorta, which is the main hose coming out of your heart. We're looking at the heart from outside, and this is your aortic valve. The left coronary arises from the left coronary cusp and divides immediately into two very early on, and descends here in the front of the heart, and therefore it's very rightfully named as left anterior descending artery. It sort of branches off, and these various branches will intermingle later on to supply the rest of the myocardium in between. The right coronary obviously clings around to the right heart border and also goes towards the apex of the heart, and similarly gives out several branches, and again intermingles to supply the intervening myocardium in between. So these are your left coronaries, and this is your right coronaries. Okay. So now, so the coronaries are being visualized through this cardiac catheterization. It's a procedure which is done in a cath lab. So here are some newer terms that you will familiarize with through this video. A cath lab is a suite where you have a fluoroscopic camera. You have an X-ray table. This is your X-ray table. And then you have a camera which is now not only giving under the visualization of X-rays, you can actually take pictures as well. So you have, and it has sometimes dual cameras. There are triple cameras depending upon, the kind of cath lab you're talking about. And basically, there's a beam which tends to go in this fashion, comes down like that. So you could be slid up like that on the X-ray table, or slid down, depending upon what positions the cardiologist desires you to have. Or sometimes the position could be even you could be rotated on one side as opposed to the other. And of course, you'll be strapped well, so this way you're nicely laying within the table, and there's no chance that you'll fall, so you'll have sort of seat belts on while you're laying down. You need to be awake, so they will give you a little bit of sedation to help you relax, but no anesthesia. You won't be out, in other words. So the cardiologist will be able to talk to you, and you'll be able to talk to the cardiologist as well, because they want your cooperation during the test as well. So they may ask you certain questions as you go along. Now, easiest thing is they find an access either in your arm. It will be here, or in your groin artery. So either of the two, and both are preferable. And previously, the patients used to be admitted the night before, but there's no need to admit them the night before. However, you'll stop eating after 10 o'clock the night before, though. And you can only have a few sips of water, only to take your medications. The rest of the instructions will be all given in the cath lab when you arrive. And when you come in, at that point, a blood test may have to be done, or an EKG may have to be done. But normally, an EKG is already done prior, so like within a week, so that's good enough. Otherwise, they'll quickly get an EKG and bring you into the cath lab. A small little needle is inserted after a small local anesthesia right in this area, for instance, and that's where the needle, through the needle, there's a guide wire. This black little wire is inserted, and that's passed through, and the needle is withdrawn. Once the needle is withdrawn, then at that point a sheath, it's called a sheath, is inserted in. with a small little aperture here that's created sometimes with a local anesthesia through the skin, and that sheath is advanced up onto the guide wire, and then the guide wire can stay in or can be removed, but normally it is removed once you have the sheath in, and now it's in the vessel. Whether it's a brachial vessel if it's going through your arm, or whether it's a femoral vessel going through the groin. And mind you, this is all done very in aseptic precautions. All sterile precautions are taken, so this way there's no chance of any infection, etc. Nicely, the whole groin or the place where the skin is being used to insert the needle, etc., will be all sterilized with good antiseptics there. Which are applied locally. Now, once the sheath is in, at that point, the catheters can be passed through here, and these catheters can be advanced or passed through. And as the catheter is advanced up all the way into the descending aorta, here you have the kidneys, obviously, and it's advanced here. Later on, it arrives into the arch of the aorta. Once it arrives into the arch of the aorta, that's where the catheters will shoot the dye. Once they have engaged into the coronaries. Now, where are the coronaries? As I said in this one here, you have the coronaries right here. Let's go to this diagram here, and you'll see the coronaries are right here. So once the coronaries are visualized, then obviously the dye will start traveling into these vessels. And as it traverses into these vessels, you might feel a little warm throughout the body, because the dye is now going obviously from the coronaries, not only from the coronaries, but also from the left ventricle is shooting up into the aorta. So the whole body feels a little warm. Sometimes you may feel a skip beat. There are times when you will actually also feel the heart being slowing down a little bit. If it slows down too further, don't worry about it, because this is all pretty normal, and the cardiologist will be standing right next to you. There'll be an assistant, there'll be a nurse or a technician, and a couple of other people, including an anesthetist also. And of course, they'll be monitoring you. They'll be checking your blood pressure. They've already drawn some bloods here. All of that is being taken into account, and EKG monitoring will be obviously done in the chest here, and and all these wires will be going on to an EKG here for testing, and of course you'll have a blood pressure cuff attached here as well. So all of these things monitoring are going on while the dye is being injected. Now, the dye is DYE, and as that is being injected, it's a contrast, basically helping visualize these coronary vessels. So one artery at a time. They start with the left or the right, depending upon whichever is quickly engageable or convenient. And once normally they start with the left first, because that is more crucial for us, very, very important for us. And so once you get the left coronary artery visualized, then they start to look at where the blockages are. Now, the blockages will appear somewhere like this, if there are any, in case because that's where the cardiac catheterization is being performed. And then they quickly know where the vessel blockages, the coronaries are blocked. These are your coronaries, and if they are blocked, obviously they like to see where they are blocked and how many blockages you have, and if you have any. Okay, so, and after that, they immediately remove that catheter. There might be another catheter they might use for the right coronary, and so on and so forth. And the whole procedure should take about 30 minutes inside the cath lab, more or less, unless they decide to do another procedure called an angioplasty or a stent, which of course may take another 30 minutes to 60 minutes, depending upon how many stents and how many angioplasties they do. But that's basically it. And a stent, of course, is a small little mesh which is placed in here. We'll show it with a different color here, for instance, and that stent will be placed here right away with a similar catheter, again up the guide wire. This guide wire, which is right here, and the catheter is passed all the way up here like that. This time it's a different catheter, because this catheter has not only a balloon, but also capable of deploying a stent. So that's when they're doing the stent, after they have inferred where the obstructions are. The obstructions are here, and they could be all managed by putting a stent. You could do all of that. Okay, so that's where we are currently, and obviously we're looking at some of these things which could hopefully be very helpful both for the patients as well as for the doctors, the medical students, the residents, interns, and of course older colleagues like us as cardiologists who have been out of the cath lab for a long time. But the fact is that it's always nice to brush up the skills all the time. That's precisely why I'm doing these short videos, to make sure that everybody understands and we're on the same page. So after the procedure is done, they remove all these catheters. All these catheters are out, and then the sheath is removed, and they seal this with a vascular device here, and sometimes they put a sandbag or a little pressure here for about a couple of hours, and you will be moved into the recovery. And once you come into the recovery room, at that point they'll watch you for another half an hour to 1 hour, depending how well you do. They'll ask you to drink a lot of water, so this way you can pee out all the contrast they gave you, and this way the kidney functions are totally well maintained and normal. They watch you for a couple of more hours and then send you to the regular room. So your family should expect you about in 2 to 3 hours roughly into the regular room, where they'll be waiting for you, obviously, and then the cardiologist will come around and make a final assessment as to tell you where the blockages were, what the cath results were, and of course if they put any stents, if there were any stents that were placed in, those all will be discussed with you, and of course advised and told to you exactly what to do next. Okay, so this was a quick short video. What is a cardiac cath? Why is it performed? And of course we know that it's performed because of coronary artery disease evaluation after a stress test that was positive, or when the suspicion for an angina, where they suspect that, or sometimes even during the acute MI, which is a heart attack setting, where they want to open up an artery and put a stent or balloon in there. Okay, so essentially this is how it's performed, and as I said, this is your left ventricle, this is your aorta. Here I've shown different schematics, and this is the artery where they've been working on, and these are the blockages in the coronaries we just talked about. And of course, as I said, this is your equipment where you'll be in the cath lab, and for a moment you'll feel like you're in the space age, but that's okay. You'll be fully awake. They'll keep you well entertained, and you should not be scared about anything, because this is a procedure which has been practiced for the past 40-50 years now, and they've improvised it so well that there's absolutely nothing to worry about. In fact, there's more something to worry about not knowing what's going on with your coronaries, especially because your suspicion is so high that they have angina, you have a heart attack, etc. ongoing, and therefore they should really be concerned about that. Once again, this is a substitute to your syllabus. If you're having an emergency, please call your doctor. Go to the hospital right away, to the nearest medical center. And this is a substitute. This is a supplement to your syllabus, not a substitute. Remember that, for the medical students. And obviously, we are not giving you any medical advice. This is purely an educational channel, medical educational and patient educational channel. Okay. Thank you again for associating with us on MuniMeterHealth. Please spread the word, and don't forget to like the button at the end of the video if you do like my schematics here. And of course, please offer some suggestions, questions, and comments, please, and we tend to answer that within 24 hours. I thank you again for your attention, and looking forward to meet you again on the next